Hello friends, welcome to our YouTube channel for nurses preparation. I am Neeraj Kumar Kaithal. From today we are starting a new video series for upcoming AIIMS norcet exam 2021. In our today's video we are presenting few important questions from cardiovascular system NCLEX Saunders. So let's begin our today's video. Our question number 1 is a client is admitted to emergency department with chest pain that is consistent with myocardial infarction based on the elevated troponin levels. Heart sounds are normal and vitals are noted in the client's chart shown below. All the vitals are shown in the chart. The nurse should alert the healthcare provider because these changes are most consistent with which complication. You have to tell by observing this client's chart what is the condition that the patient is developing after having MI. Let's observe the client's chart. 4 times vitals are recorded upon 11 a.m., 11:15, 11:30 and 11:45. Pulse rate 92, respiration 24 and the BP was 140 upon 88 at the time 11 am. After 15 minutes, pulse rate slightly increased 96, respiration also increased 26 and the blood pressure was reduced. It was 128 upon 82 mmHg. After its 15 minutes, 11:30 am, the pulse rate also increased. Person is now having tachycardia. Pulse rate was 104, respiration 28 beats per minute and the BP was reduced 104 upon 68 mm of Hg. And on 11:45 am, client is having pulse rate 118 per minute, respiration 32 per minute and the BP was 88 upon 58 mm of Hg. Observe this chart and decide the condition. Option A, the patient is developing cardiogenic shock. Option B, patient is having cardiac tamponade condition. Option C, pulmonary embolism. Option D, dissecting thoracic aortic aneurysm. Which one is the correct? So friends, here's the right answer is option A, cardiogenic shock. The patient is developing cardiogenic shock because in cardiogenic shock, pulse rate and respiration is continuously increasing and the blood pressure is reduced. We can see in the diagram at 11 am pulse rate was 92 beats per minute and after 45 minutes the pulse rate was 118 beats per minute and the respiration was in initial time 24 and after 45 minutes it was 32 breaths per minute and the BP goes down 140 upon 88 to 88 upon 58 mm of Hg. Simply we can say if a person is having cardiogenic shock, in this condition his pulse rate and respiration rate continuously increasing and its BP gonna below than normal. Let's understand about the cardiogenic shock. In cardiogenic shock condition, left ventricle is damaged more than 40%. Important classical signs of cardiogenic shock are weak rapid pulse, hypotension, decreased urine output, cool clammy skin and increased respiration rate. Question number 2. Client is admitted with chest pain and history of type 2 diabetes mellitus. Is scheduled for cardiac catheterization. Which medicine need to be withheld for 24 hours before and 48 hours after the procedure? A client come in hospital with complaint of chest pain. After taking history, we found he is also suffering with type 2 diabetes mellitus. For the diagnosis purpose, we have to perform cardiac catheterization in this patient. Cardiac catheterization is mainly done to assess the heart's wellness or the functioning of the blood vessels near heart. In this procedure, we insert a hollow tube. In the given four options, option A glipizide, option B metformin, option C rifaglimin and option D regular insulin, all these four medicines are used for the treatment of diabetes mellitus. We have to choose the one option which medicine need to be withheld for 24 hours before and 48 hours after the procedure. The right answer of this question is option B, metformin. A contrast medium is administered during the cardiac catheterization procedure, and if the contrast medium affects the person's kidney, there is a chance of occurring lactic acidosis condition. To prevent person from this lactic acidosis condition, for the precaution, we withheld the metformin medicine from before the 24 hours of procedure and up to after 48 hours of the procedure. All the options, all the drugs are anti-diabetic medicines. You can take a screenshot for your revision purpose only. Next question is, client is in sinus bradycardia with a heart rate of 45 beats per minute. Sinus bradycardia means heart rate less than 60 beats per minute. Complaints of dizziness. Dizziness means spinning of head. And with the BP of 82/60 mm of Hg. In this situation, what will be the prescription by the healthcare provider? Option A, administration of digoxin. Option B, defibrillate the client. Option C, continue monitor the client. Or option D, prepare for transcutaneous pacing. It is also known as external pacing. A client whose heart rate is 45 beats per minute, complains dizziness and having the blood pressure 82/60 mm of Hg. In this situation, what will be the prescription by the doctor? Choose the right answer and write down in the comment section below. The right answer in this situation is option D. Prepare for transcutaneous pacing. Prepare the client for transcutaneous pacing. Let's see the rationale. Let's see about the rationale. Sinus bradycardia, hypotension and dizziness all are the signs of decreased cardiac output. To treat this condition, to treat this situation, transcutaneous pacing is done to increase heart rate, and that causes increased tissue perfusion. Hypotension, heart rate below 60 beats per minute and dizziness all are the signs of decreased cardiac output. To treat this situation, we have to increase the heart rate, and for this purpose we perform transcutaneous pacing. By this, heart rate increases and that causes increased tissue perfusion. Don't confuse here with the term defibrillation. That is a different thing. Transcutaneous pacing is a temporary method for pacing heart in emergency situation. Transcutaneous pacing is a temporary method used in emergency situation. Defibrillation. Defibrillation used in the treatment of PVT, pulseless ventricular tachycardia, and ventricular fibrillation. Defibrillation is the technique used for the treatment of pulseless ventricular tachycardia and ventricular fibrillation. You can take a screenshot for your revision purpose only. So everyone, This was our today's video for AIIMS norcet exam 2021. How was the video? Give us your valuable feedback in comment section below. Thanks for watching. Keep supporting, keep participating, and all the best.